Hello, everyone, and welcome back to my channel, and welcome back to another episode of our 100 clinically oriented anatomy questions. This is question 53, and of course, the third question in our upper limb series. Let's jump straight into it. So, the question says a patient complains to his physician that his thumb doesn't work right. The physician notes weakness of the thumb in extension, although rotation, flexion, abduction, adduction, and opposition are normal. Which of the following nerves is most likely involved? So let's discuss this. This is more like a follow-up on question 52. In question 52, I discussed extensively the median nerve. All right. So you can go back and check question 52 in case you've not watched it and you want to check this. Question 52 will make this 53 easier a bit. All right, so let's jump straight into it. So they said there's a weakness in extension. So I mentioned that anytime you hear extension in the upper limb, most likely it will be the radial nerve, because the radial nerve innervates all the extensor muscles from the arm down to the hand, the triceps, your extensor carpi radialis, extensor carpi ulnaris, even the brachioradialis, basically all muscles that do extension. Now, the rotation, the flexion, abduction, adduction, and opposition of the thumb are normal. The muscles that do rotation, flexion, abduction, adduction, opposition of the thumb basically are for the flexion, you have the flexor pollicis longus. The flexor pollicis longus is innervated by the median nerve. So opposition, abduction, adduction, these muscles, the muscles that carry out these functions are basically the thinner muscles, and the thinner muscles you have three of them, sometimes four, but majorly three of them. And the three muscles are the abductor pollicis brevis, the opponens pollicis, and the flexor pollicis brevis. All right, so these three muscles are innervated by the median nerve, except for the deep head of the flexor pollicis brevis. That could come out in your exam or in your test. Although the three muscles are innervated by the median nerve, but the flexor pollicis brevis has double innervation. So the question can come as which of the thinner muscles has double innervation. So it's the flexor pollicis brevis. It has the superficial head and the deep head. The superficial head is innervated by the median nerve. That also innervates the other two, that is the opponens pollicis and the abductor pollicis brevis. Then the deep head of the flexor pollicis brevis, like I said, is innervated by the ulnar nerve. So these muscles, like I said, flexor pollicis brevis, opponens pollicis, they are the ones that do flexion, they do abduction, adduction, opposition of the thumb, basically. And of course, the flexor pollicis longus at the forearm. It also helps in flexion of the thumb. So since we've established that the median nerve is the one that innervates these muscles, it means anywhere the median nerve appears in our options is obviously wrong. So option A is out of our option B is out, and option C is out. So we have radial and ulnar nerve only. Like I said, the radial nerve is most likely the correct answer, and it is actually the correct answer because the radial nerve innervates the muscle that does extension of the thumb. What muscle does extension of the thumb? It is the extensor pollicis longus and the extensor pollicis brevis. These are the two muscles that extend the thumb. Extensor pollicis longus, extensor pollicis brevis. So the extensor pollicis longus and the extensor pollicis brevis are innervated by the radial nerve, and of course they are in the posterior compartment of the forearm or the extensor compartment of the forearm. Anyone that works for you. So the correct answer is the radial nerve only. So the ulnar nerve innervates the intrinsic muscles of the forearm. Sorry, the intrinsic muscles of the arm. That was a mistake. Of the hand. Sorry. So the ulnar nerve innervates the intrinsic muscles of the hand, the dorsal interosseous, the palmar interosseous, the adductor pollicis that adducts the hand. Sorry, that adducts the thumb. The adductor pollicis that adducts the thumb. They've already mentioned adduction here, and of course, it's the ulnar nerve, so it can definitely not be correct because they said the adduction of the thumb is normal. So the adductor pollicis, the interosseous muscles, the lumbrical muscles, and stuff, those ones are innervated by the ulnar nerve. And the radial nerve is majorly for extension, and it innervates the extensor pollicis longus and extensor pollicis brevis. And those are the muscles that are weak in this patient. That is why the patient cannot do extension of the thumb. So I believe that was explanatory enough, and you do understand and you enjoyed the video. And I will see you in the next episode. Bye.